In the last video, we talked about, right at the end, we talked about vitamin D. And so, what role does vitamin D play in all this? Some people are saying it's a cure. Some people are saying take mega doses of it. How does it play a role in it with this COVID-19? First of all, remember the alveolar or the air sac cells and the artery cells, the cells that make up the artery where the oxygen and CO2, those important cells where we breathe in and we breathe oxygen in and blow off CO2, those cells, the cells that COVID-19 attacks and tears down. Well, what happens with vitamin D, and I'm going to simplify this so people can understand what vitamin D does. It kind of blocks the virus from attacking so many cells. There's also vitamin D receptors on those cells. And through the physiology of the lung and the immune system, which vitamin D is involved with, and this COVID-19 virus, the vitamin D is able to fight against all of the inflammation and the tearing down of the architecture of the lung and help people to hold on. And so now we do know, several hospitals have reported around the world that those patients that are in the hospital that do the worst, that die, that barely make it, 80% in some of the hospitals, 80% of those patients are vitamin D deficient. So that is compelling evidence that vitamin D somehow is really important in this whole scheme of things with this COVID-19. So we know that, and so based on that information, I think it would be very important, and I'm recommending to everyone. I take 4,000 international units of vitamin D daily. I'm recommending to patients to see their doctor, check your vitamin D level, and then ask your doctor what dose you should be on. Because I believe, and many other of my other colleagues believe, that vitamin D is important. Right now, there's 3 major studies going on. One in the USA that's looking at vitamin D in combination with aspirin and seeing how that plays an effect on this COVID-19. There's one in France, and there's also one being done in Iran. So there's 3 major studies going on to try to figure out more about how this vitamin D plays a role. Couple important things. There are certain people that are vulnerable to being vitamin D deficient. One are people of color. The melanin in my skin does not allow the sun to convert the chemical in my skin to the active form of vitamin D. It just doesn't. It does it at a very slow rate, and there's a very minimum amount of vitamin D converted by sunlight in people of color. So people of color need to take vitamin D supplements. For real, we need to do that. We need to go to our doctor, we need to get our vitamin D checked, and we need to be on a vitamin D supplement. Secondly, people that are obese, they have a difficult time with conversion to the active form of vitamin D. And the third group that I'll mention is older people, the geriatric population, just are unable to make the conversion into the active form of vitamin D. So those people, we definitely want to be, if it's your grandmother, your mother, your relative that's elderly, you want to be checking on that. That's something that we can do. And and again, I'm going to emphasize that wearing the mask is very important. Washing our hands is very important. You can't do those things enough. And thirdly, social distancing is very important. So we got to keep. Those are things that we can do to help slow this down while the scientists figure out a vaccine, while our government figures out, what should be open, what should not be open. We're all wanting to get back to, well, we won't be getting back to the normal. It's going to be the new normal. But even at that, we want to get back to some kind of normal way of living. And so, again, let's do all that we can do. Each of us can do those things, and not difficult to do, but we have to do it. We have to take this thing serious. It's still out there. People are still dying. People are still being infected. So let's do it. We can do it. We can recover. So let's do it. Thank you.